too many young children, the joy of childhood is cut short due to sexual abuse. Child sexual abuse affects lots of children each year. I am Oyinlola Sally, and today on A Woman's World, we tackle the issue of child sexual abuse. Later on, we will meet a woman who is bold, creative, and a mix of beauty and brains. Child sexual abuse is a global issue that needs to be tackled. I have in the studio to discuss this Dr. Princess Olufemi Kayode, a sexual violence expert. You're welcome.
Thank you for having me.
Recently, there has been a lot in the media. I mean, in India, there are young girls who are being raped, and this is happening around the world. As an expert, what are the effects of sexual abuse on the female child, her family, and the society?
For the victim, the child victim, you have issues of both short and long-term consequences because of the abuse. And that can be shared into the physical, and then also you're looking at the emotional and then the mental. For the physical, you're looking at health issues. You're looking at, there's a lot of trauma to the body. And you're looking at, sometimes there could be tear, which means that the child will be stitched. And then also you want to look at preventing HIV, preventing other STIs, which is sexually transmitted infections, preventing pregnancy. And there's some almost immediate what we call emergency medical response, which means within 72 hours of rape, to prevent HIV, there is a drug, post-exposure prophylaxis, called PEP, that needs to be accessed. Then to avoid pregnancy, there's what we call the emergency contraceptive, that needs also to be accessed within, those ones can only be accessed within 72 hours. While, of course, there are other treatments going on to prevent any other form of sexually transmitted infection. They're looking at things to also, for some kids, it actually really depends upon exactly what really happened. Some have a lot of medical trauma that will need surgery for a long time. And within all of this now, you begin to look at the emotional aspect of this and how this impacts on the child victim. Now, we're not talking about the family. The child victim, we have a lot of saying, people say, she's a child, she would forget. They do not forget.
At all, at all.
Some memory may be suppressed.
Yes.
And some almost in a few months, a few weeks, depending on because things happen to us and we react individually differently.
And they could even lose their self-esteem.
That is part of what comes up in the long term. One of the things that come up in the long term. But we're looking at children beginning to do inappropriate sexual behavior. I've seen a 1-year-old child who would, while playing, just go off play and pull the pampers a little bit with one finger and use the other one and begins to finger herself. That is an inappropriate behavior of responding to something that's happened to her. So you find some behavior that a child begins to behave and you begin to wonder, what has happened to this child? Is it sexual?
Where did it come from?
Exactly. So it's either a child has seen or a child has been touched. When you begin to see a child give certain reactions. And you want to now look at how some children begin they reduce, they come back, they regress back to a lower age. If the child was 7, the child start behaving like a 3-4-year-old.
Oh, wow.
That could also happen. You can have nightmares, flashbacks, and this impacts a lot on health. They could begin to develop some other health, the growth, educational-wise, if the child's already in school.
Child's future.
She could, and then some may become juveniles. So there are different reactions. And then you're talking about psychological effects now. Talking about things that stay in there. You feel cheated, you feel blamed. Some people blame themselves for the rest of their life. And that starts from when it happened to them. It was my fault, maybe if I'd done this, if I'd done that, it wouldn't have happened. And that impacts a lot upon their person. And then of course, self-esteem issues, trust issues.
That's a major one.
Because we're talking about the people, they think happening in India, you have quite a lot of stranger rape going on in India.
Yes,
but the majority across the world is basically non-stranger sexual violence, which is basically people that we know, the entire family, society, and the child knows, and we're in the position of trust, responsibility to care for the child, and the position of authority over the child.
But how can we protect these children from the pedophiles?
Wow. Basically, there are a few steps to guide. We should not also forget it's a crime of power. Don't forget it's a crime. In all societies, it's actually a crime. And then it's a crime of power. So as much as we want to prevent, which is we can do our best to reduce the risk of a child. Because we're talking about people who are higher positions over me, and they can actually do what they want to do. But if I have certain knowledge and I've been schooled to open up about things that happen to me, that helps. Teaching children the appropriate names for parts of the body.
So what are the recovery steps that should be taken to help the victim get over the attack?
What needs to be done starts at the very beginning. When a child discloses, and most times we have accidental disclosure.
Okay.
When a child opens up, the response and the way and manner with which we respond to the child begins to determine if there's going to be recovery. That's where you know whether there's going to be healing or we're going to compound the matter for the child, for their future. So how we deal with it, and which is because most people do not understand the dynamics of sexual abuse on the child. So we react because of that kind of reaction.
Yes.
Some children are beaten almost immediately. They are beaten when they open up to say, this person has done this to me. They are beaten first and foremost before they take any action. What needs to be done is to listen to the child. We have to be able to manage our emotions and control it, because it can be traumatic. Controlling doesn't mean just reacting to the child alone or to whoever the child is. And you can't call somebody and say, my child said, of course the person is going to tell you no.
Of course.
It's going to say no. I mean, not.
Yes.
You find that person must really have an issue of insanity to tell you, yes, I did it.
You know,
most of them will not open up.
Yes.
Yeah. So recovery is the child has opened up. The way and manner we respond to it is one. Then two, we call them first responders. We are one. But we're talking about the police, the hospital, social welfare. How they respond also matters on the impact of recovery. If a child is being taken around, she gets to the police station and she has to talk to this officer, and then they call another officer to, okay, you go and take the statement. She has to narrate. So the child keeps going and talking about it all over. And then they now say, okay, come. And where's the accused person? Okay, you stand there. You stand there. This family is there. What did you say he did to you? A lot of all of this does not help anything called recovery.
we just need to break the silence.
So we find that we're compounding issues for that child, trauma, and then of course there's distrust in the system.
And even fear. I mean, the child
Definitely.
is scared.
Some children will recant.
Yes.
That it didn't happen. Some will recant, it didn't happen, because they're looking face to face, and this person who has been threatening them, you know, threat is not sometimes beating or touching the child. Sometimes threat is just the use of words. And children take us for what we say.
That's true.
A 5-year-old girl and an 8-year-old girl who opened up, by the time she was going to open up, she thought she was going to die. And so she now said, okay, I think if I'm going to die, I should let my mom know what's been happening to me and why I'm going to die. Because she was going through severe pain, she's been infected.
And low self-esteem.
And she had to open up to say, this person has been doing this and this to me, and I now know I'm going to die, so I'm letting you know. That's why she opened up. So there are a lot of reasons why children don't speak, and when they eventually open up, they need that help. So what they need from us is understanding and empathy.
Yeah, and that's where you come in.
And that's of course what we do. We also do counseling, we do trauma management counseling, we do long-term counseling, we do family support, which means the family has to be, which is one of the first questions you did ask, which is upon the family,
Society.
no father or mother or caregiver, you know, want to imagine.
That this is
Because, you know, when you're talking, when we receive words, we receive pictures.
Yes.
One picture, they even cannot conceive the picture of it happening. And so they're also traumatized. You have impacted that family with trauma. Everybody's on the edge. And it takes counseling for them to go through therapy as a family.
Yes.
On knowing how to handle the matter. And then the society, of course, most of the children do not grow up to full potential. Most of the girls, I'm even using children because it happens to boys as well. Most of them end up not, you know, like I said, some become juvenile, some end up in sex work. Depends on who is abusing who. If it's going to be a family person, they end up, or father or mother or uncle, brother, you know, they end up running out in the streets. And you find a lot of them have sexual problem.
Well, this was really insightful and informative. Thank you very much. It
Thank you
was
for
really nice
having
having
me.
you on our show today.
Thank you so much.
Thank you.